Okay, good morning, everybody. My name is Amy Roth. I'm the Assistant Director for the Developmental Disabilities Services Division at the Vermont Department of Disabilities, Aging, and Independent Living, the state of Vermont. I am happy to be with you talking about home supports today for adults in home and community-based developmental disability services, what we also refer to these days as HCBS. And folks used to call this the DS waiver. So if you have heard those two terms, they're basically interchangeable. We try to get away from the DS waiver thing these days because HCBS is the correct federal and state term. Our services are under the Global Commitment to Health waiver with the state of Vermont for all Medicaid services. I've worked for the division for many years. I've been in developmental disability services basically since 1990. I started out working for the designated agency Howard Center up in Burlington and did a lot of direct support. I was the manager of a group home and organized community activities and events for folks in Chittenden County for a number of years, and then moved to working for the state in developmental disability services. So I've been around for a while. Our division, just very briefly, is kind of comprised of 3 stools. We are not really very big. We have a kind of a policy wing, which is my staff, the specialists. And then we have a quality management team that looks at quality issues with services at all of our provider agencies. And then we also have the Office of Public Guardian, which is public guardianship for adults who require guardianship, who don't have a private person in their life who can do that. So that's basically who we are. So I'm going to launch into our first. Janice is very kindly doing this for me. Should we just hit that? There we go. Okay. So, oh, no, let's go back to that one right before. There we go. Okay. So the Developmental Disabilities Act of 1996 is the statute, the law that drives our service system for developmental disability services, HCBS. And I just wanted to draw folks' attention to the concept of community participation. This is under one of our principles of developmental disability services, of which there is a long list, I think 12 of them. This really sets the stage for individuals with disabilities being integrated into their communities, living, working, playing, going to school in their communities and engaging in their communities. And this is a core principle and value and belief for our service system. And we have, made every effort, sometimes successfully, sometimes not as successfully, to follow this principle in our service system. There are kind of three documents that really drive our, kind of our whole process. One is the Vermont State System of Care Plan that's mandated to be developed and revised every 3 years. The other is our regulations that implement the Developmental Disabilities Act. And then we have a Medicaid manual that discusses what can and cannot be paid for in our service system. So I also wanted, in the context of home supports, to address this, let people know that HCBS must be consistent with federal HCBS rules. So people are, hopefully living in their own homes or in homes where they have chosen, are integrated in their communities, and the homes must honor and support the person's right to free association and privacy. and cannot inhibit the person receiving services from knowing and being known by others in the community and forming enduring relationships in their communities. Okay, so I'm going to launch into home supports, and I just want to remind folks that home supports are only one component of a person's service plan, and not everybody who qualifies for developmental disability services may require home supports. We have lots of folks who live pretty independently and with a little bit of service coordination and perhaps community supports to assist them with accessing their community, with transportation, with banking, maybe with shopping, and that's sufficient to meet their needs. There are individuals who live with their families who maybe need assistance with their employment supports as adults, and they also may need help with service coordination or case management. So when we talk about home supports, we're talking about the folks who really are at, kind of at the most intensive level of need, who for whatever reason cannot live with family or really require, a 24/7 supports. Although one category under home supports, supervised living, are intermittent supports, which may be provided for a few hours a day to one or two people who live either in their own home or with their family members. The other three categories, shared living, staff living, and group living under home supports, are 24-hour wrap supports for folks who need that level of care. So shared living is individualized for one or two people in the home of a provider. Sometimes these folks are referred to as home providers, sometimes shared living providers. You may hear that term, it's interchangeable. This is a service that must be provided under the auspices of a designated agency or a specialized service agency. Those are our entities in the state that have contracts with the state of Vermont. So Medicaid dollars are funneled down to them, and they have oversight of those homes. And the home must be the residence of the provider. It can be an apartment, it can be a house, and they could be renting it or owning it, but it must be their residence in order for them to receive a tax-free stipend. That's part of the deal that those providers receive, a difficulty of care stipend. Staff living is our home supports for one or two people who are, again, living in a home or an apartment that is owned or rented by the DA or SSA. It's 24-hour support provided by staff that are hired and trained by the agency. So it's a very high level, intensive level of support, and it is costly. Supervised living, I talked about a little bit. If folks have other questions about that, please feel free to jot them down. Group living are our group homes. We have a number of group homes around the state. They are generally owned or rented by one of those provider agencies, the DAs. I don't think we have any SSAs currently that have group homes. I believe they're all within our designated agency system. There are 3 to 6 people who live in them. Most of them now are 3 or 4 individuals. There are only a few with 6. And 24-hour support, again, is provided by agency staff. And it's a very high level of oversight that needs to be maintained by the agency for those homes. And it, again, is a fairly costly option. Okay. So I threw up here some data from fiscal year 2018. Every year, our division publishes a report, an annual report on our services. So this data on this on this slide and the one following about Vermont within the national scene, both come from our annual report of 2018. So these are the numbers. Now, keep in mind that altogether in home and community-based services, we are serving over 4,000 people, between 4,000 and 5,000 people in the state of Vermont. So again, these are the numbers of people who are receiving home supports. So 1,376 who were served in shared living homes, 52 folks who live in that staff living model, where it's just one or two of them with staff around the clock, 91 folks residing in group homes, 241 individuals receiving supervised living support. So that means that they are living either with family or in another living situation and receiving some intermittent or daily, hourly supports. And 302 folks residing independently with no paid home supports at all. We do have 6 people who live in, we have one ICF, that stands for Intermediate Care / Developmental Disability. That's a facility. It's actually not considered home and community-based services. Many states have many of them. Vermont has one. It's in Rutland County, and it's for individuals who have a very high level of medical need, and there are nursing services provided round the clock in that home, and there are 6 folks who live there. So again, some data about where Vermont ranks in terms of the whole country. We are #1 nationally in terms of non-family residential settings with 1 to 3 people. So many states, there are many states that have deinstitutionalized, that have closed their large institutions now. However, many still have large group homes, large ICFDDs with large numbers of people, 12, 15, 20-something people residing in those homes. Vermont, we have intentionally tried and have been successful at keeping the numbers low. And what this means for us is that services are more personalized, individualized, person-centered, and we're very proud of these statistics. We're only one of 3 states that has no residential settings with more than 6 people with DD living in a home, and 18% of those receiving long-term services and supports across the country live in settings of more than 6 people with DD. Okay, so we're going to jump into the pros and cons of these circumstances, because we know over the years our system has evolved. People have different needs than they did when we closed Brandon Training School in 1993, and we were trying to figure out how to best serve people in their communities. But we have a lot of historical information about shared living and what works in that environment. The biggest thing really is that with the right match between a shared living provider and an individual, people are safe and healthy and develop enduring relationships and often have a really long-term stability and consistency. We have individuals now who have lived in shared living homes for over 20 years, and with home provider families that are, truly have included them, have made them a part of their family. We have second-generation homes now, sons and daughters of home providers from the 1990s who have become home providers themselves. And again, it's so much of it is about relationship and creating an environment of support, safety, and comfort for individuals, and being able to be person-centered in those environments. Shared living providers are usually providing transportation to many of the things that happen in people's lives, and often taking folks on vacations. We have shared living providers who take folks to Florida for a couple of months in the wintertime. So it's, again, the model has really evolved. Shared living homes are monitored by the designated agency, the specialized service agency. Shared living providers are important individuals on a person's team. It's generally a cost-effective residential option because providers receive a stipend that's exempt from federal and state income tax. And we have high expectations of those providers, and many of them have been able to step up to that level of responsibility. We also, again, as needs have changed over the years, and we've been addressing the needs of more and more individuals on the autism spectrum, people that have challenging behavioral and mental health needs. We have tried to work with agencies to develop kind of hybrid models if it was needed to try to figure out the best way to support people. So there are some situations people may live in two homes, two providers, where they actually go back and forth, or the two providers work together to figure out a schedule that works for them and for the individual. People who live part-time with their family and part-time with a provider. Sometimes this is a good transition for folks transitioning from if they've lived with their family for a long time, and we know it's going to be challenging and potentially traumatic for them to step away from their family and live in a different situation. Or we also have situations where we have agency staff who are providing some staff supports for folks in the home, or home providers who have large respite packages to be able to use respite workers flexibly for individuals who have high medical or behavioral issues. Some of the challenges, and we all know this, we know the challenges. I'm sure many of you know the challenges. If the placement doesn't work out, it's the person who must move out of the home. It's not the home provider because it is their residence. And sometimes we do know that it can, shared living can be trial and error in some circumstances, and it might take 1 or 2 or 3 placements before the right match is found for an individual that's going to be long-term. And that can be tough. The other issue is that it can be very comfortable once people are situated in a home and feel very safe. And as people become integrated into, sort of the rhythms of their life and the shared living provider's life, to challenge folks to gain skills and to grow and develop confidence to, build independent living skills and potentially move into a more independent setting to either live on their own or in a setting with fewer supports is not necessarily an easy thing, the way we have kind of designed shared living to be a kind of a long-term enduring home support. So, and we, sometimes it makes sense. We see people coming to our funding committee for, requesting funding for supports, asking for a shared living situation, and we'll ask the question, well, it seems like maybe with a little support, with some help, with some skill building over a few years for this person, maybe they could live independently. Maybe they could live in their own apartment. Maybe they could live in an apartment with another person or with a mentor. And can the agency focus on developing more of a model like that, where shared living is more of an interim, maybe 3 to 5 year situation, and the person can move into a different setting. So that's something that we have talked about a good bit at the division. Shared living can limit a person's exposure to other people, places, and lifestyles that are not within the home provider's scope or experience. We have lots of folks living in very rural places throughout the state of Vermont, and again, that's a particular lifestyle, and so what people are exposed to can be limited. Shared living providers have a lot on their plate. They have to be the employers of record for respite supports. Sometimes they're also the employer of record for community supports, which means that they have the responsibility to hire and train and supervise workers, and that's a lot to handle. And when a person is in shared living supports, the designated agency or the specialized service agency is responsible for their health and safety 24/7 because they have the oversight of those homes. And they really need to be looking at both the health and the safety of the person in services, and that those providers are getting the support that they need, that they're following our regulations and guidelines, that people's individual support agreements are being followed, and that those providers are getting the necessary breaks from intensive levels of supervision to prevent them from burning out or becoming ill or developing problems themselves. So jumping to staff living and group living and what works in those scenarios. Staff in those scenarios are hired, trained, and supervised by the agency. So again, the agency is entirely responsible, the designated agency or the specialized service agency, for that staffing. And this is a good thing in that there are shifts of staff, so the burnout risk is reduced. And the agency holds that responsibility. But then there's also turnover, and so that's one of the issues when we get to the challenges. Okay, have one question here. I'll get to it in just a moment. The staff, another advantage is staff provide transportation. Staff may have clinical training and a level of expertise to address behavior challenges in a therapeutic manner. And the folks who live often in the staff living scenarios are people that do have some level of behavior challenge. The special care procedures, which are medical procedures that have regulation around them in our health and wellness guidelines, and medication administration are both overseen and monitored by the agency. And the group homes, all of our group homes are licensed. They must be licensed by the state of Vermont by our Division of Licensing and Protection. And so they are subject to regular monitoring and scrutiny from DLP, as well as from our agency, from DDSD. So, Janice, you want to? Okay, so there was a question about, can supervised living have more than two people living together? So the supervised living scenarios can vary enormously. There could be an individual living with with family, or a person who's living with a group of friends. It's about what's paid and what's not paid. So if an individual is living in let's say an apartment in Burlington with two roommates, and they are a person with developmental disability, but they don't require the 24-hour supports, but they need assistance with some help perhaps with cooking or with budgeting their money, they could have supervised living. They could have a staff person coming in to help them a couple of hours a day with those kinds of tasks in that environment. But that staff person, that's considered supervised living, but that staff person is not responsible for any care or support of the other individuals who are living in that home. And that can't be, a home that's being paid with any funding. So I hope that kind of answers the question. Supervised living is really runs the gamut from people needing just supervision. So somebody who lives at home with their parents and they come home from their employment supports and they need someone to be with them because they literally cannot be left alone until their own parent gets home from work. So they need staff to be with them for a couple of hours until their parent gets home from work, and they're working with them in the home on some of those tasks like cooking, doing laundry, working on their budget, learning some skills within their home. Or it actually could be a person who's living on their own in a very unsupported setting, but needs help with some discrete tasks. So I hope that answers that question. Why do people say Vermont doesn't have group homes? I don't know the answer to that question. Vermont does have group homes, but again, we have some very clear restrictions in our system of care plan about group homes and the development of them, and they must be licensed by DLP and they must be overseen by one of our provider agencies. Okay, so jumping to the challenges around staffed living and group living, as I started to reference talking about the previous slide, that staff turnover can present major issues for both the agency and individuals and services. It can really impact people's level of trust and relationship building. It is challenging for agencies. It's costly to hire, train, and retain staff and then have them leave after 6 months. That's, as people, I'm sure you all can tell, that's a real challenge. Staff settings mean that the life of the person is based upon staffing shifts. So staff shifts might not address needs in a flexible manner for individuals to be able to really, kind of follow the rhythm of their particular needs and their wishes. They may be able to access some types of activities in the community that they like and enjoy and not get to others. And there might be limited opportunities to pursue employment in staff settings. Again, very dependent upon the agency, hiring the right number and the right match of staff for that particular setting. Group homes may be a lovely, harmonious environment with compatible individuals living together, but people's needs change over time. And if individuals start to develop, different types of issues in their life, including medical or, mental health challenges, it really may not be the best environment for them. It's really on the designated agency in consultation with the division to make sure that the individuals living in that home, in those group homes, are a good match for that particular environment. Again, group home staff might have limited options to individualized supports, depending upon the staffing ratio. If, whether or not people can get out in the community to do preferred activities, to go to work, and things like that. Of course, medical appointments and medical needs are going to be prioritized, but sometimes the fun stuff, the volunteer stuff, the other things that people like to engage in may be limited. And staff living arrangements, group homes, and these individualized staff living arrangements are very costly because the cost of staffing with agency, requirements and benefits and overhead is expensive. So I want to talk a little bit about what we have heard from people and from families about what they want in the realm of home supports. Um, People who are graduating from high school now, who have been in mainstream classrooms and have received a really different kind of educational support than folks did 15 or 20 or 30 years ago, whose families have expectation that they're going to have jobs, they're going to have independence. They want different things now than folks wanted or needed many years back. So we are trying to address that. People want choice and control in models of home support. People want support to move towards more autonomy and independence, to access post-secondary educational opportunities, vocational opportunities, and career development. Of course, families want settings that are going to promote safety and health and avoid the risk of exploitation for folks. People want affordable apartments and transportation access, which is a challenge not only for people with disabilities, but for a lot of folks throughout the state of Vermont, as we well know. This is a big issue, and it's just intensified for individuals with developmental disabilities. People want shared living, that if they're going to be in a shared living situation, they want it to be person-centered, focused on the needs and wishes and skill development of the individual, so that they can grow and develop to their potential. People want opportunities for peers to live together, for individuals to live with friends, to be able to access friends, to be able to have the types of relationships that they want to have as typical people in the community. People want crisis response and clinical resources. This is another issue that we have grappled with making sure that all of our provider agencies have good crisis response and clinical acumen to bring to the table for all of the changing needs of folks as they develop through their lives. And of course, more assistance for aging parents when their adult children are living at home. This is a greater need, an expanding need in our population with better health care. As we all know, our parents are living longer. Individuals with disabilities who have medical challenges are living longer, and so people need more assistance as those life changes happen throughout their lives. We'd love to be able to address all of these and say, yep, we're going to be able to, fix everything and make it all perfect. We can't. But as many of you may know, we had last spring, we hosted an innovation think tank at Lake Maury Inn, and invited all of our stakeholders, many families, individuals and services, Green Mountain self-advocates, provider agencies, to meet with us and to talk about not only home supports, but an array of our support options, what people think is working, what they like, what they don't like, what they would like us to do better or to focus on for the future. So the division has been evaluating that all of the information that came out of the think tank, and we have come up with some initiatives to explore under the arena of home supports. You can switch to the next one. Okay. So there have been some very successful transitional housing support options that have been developed in a few places across the state. Some of those have been connected to post-secondary opportunities, like the Succeed program, which is a program that's that was created by the Howard Center in Chittenden County, that incorporates some post-secondary work with the University of Vermont and CCV, and building life skills for people. So it's usually, I believe, 1 to 3 year. Most people stay in the program for either 2 or 3 years, and folks live together in Burlington, work on a lot of skill building, take some classes, and learn how to use public transportation, and then hopefully transition into more independent settings, living with a friend, or living independently in an apartment in Burlington or Winooski or Essex. Based on the success of that model, we think that there's potential to explore some similar types of models in other parts of the state, and we'd like to do some work with some of our other providers to explore some similar types of situations. We do have a post-secondary thing going on, I believe, at Castleton now. Our employment coordinator in a supported employment specialist in the state is Jenny Masterson. Many of you may know her. She also works on our quality team, and she's our expert on all of the post-secondary opportunities throughout the state. We have a college steps program, so I think college steps is at Johnson. And again, I may not have all of this correct, but Jenny is a great resource around that. So this is something that we're really interested in looking at, for young people, for people perhaps between the ages of 18 and 25 or 26. Okay, affordable housing. This is a big one. There's not a whole heck of a lot that we can do in our own little world at DDSD. This really has to do with building collaborations and connections in local communities, and with state partners and federal partners around housing options in communities. We actually just found out there is a HUD grant. I hadn't heard about this, but I literally heard about this yesterday. And there's a possibility of an influx of a new set of housing vouchers for apartments in a number of different parts of the state. And I don't know what those communities are yet. I don't have details about this, but we're a little bit excited, withholding too much excitement because we don't really know how many vouchers this is going to mean and where they're located. But as soon as we have information, we'll be getting that out to folks. And we really want to encourage our provider agencies to make those local connections in their communities, and to think about possible ways to integrate more people into housing, local housing opportunities, apartment complexes in their local communities. And another thing that we have been talking about, and I made reference to this a little bit before when we were talking about shared living, that there, it seems like shared living could be kind of re-examined a little more closely and perhaps categorized a little bit differently, thinking about the different needs of individuals, and who could we develop some shared living providers who are specialized in certain arenas, like developing more skill building for folks who may be interested in being able to live more independently. And this is something that, again, we would really have to flesh out how this would look if we had 3 or 4 different categories of shared living providers, and work with our provider agencies to kind of develop particular areas of expertise among shared living providers and compensate them accordingly. So those are the three things that we're really very, very interested in looking at in more depth. We have not set up a work plan yet, but we will be having more discussions about this. And we will seek stakeholder input. We will seek input and ideas from individuals and families. We will probably develop some work groups, and we'd love if you're interested in participating in those or contributing your ideas. We will look for you and look to hear from you. Okay, so there are a number of questions that I will start to try to answer. Can a person on supervised living who owns her own home but parents have passed away have 24/7 supervision such as a mentor would provide? They could have a mentor living with them. I'm assuming that means somebody living with them in their home. That can't be a non-taxed stipend. That must be taxed if somebody is living in the home with them. So that person would have to pay taxes on their stipend. But that is a possibility for a person who lives in their own home. Can more than two individuals with disabilities live in one home with one member of staff? Basically, the answer is no, because any home that's three or more needs to be licensed if they're unrelated individuals. If there is a home with two individuals who are related to one another and related to the provider, so for example, there are a few shared living homes that I'm aware of where the home provider has two individuals with developmental disabilities under HCBS living with them. And then they are also supporting an elderly relative under Choices for Care waiver. And they can have those three individuals in the home because the person under the Choices for Care waiver is living with them and being cared for them is actually a relative. So that is one circumstance. But more than two people living in a home with staffing has to be a licensed situation. What systems are in place to screen staff background, investigate before working with individuals? That is an excellent question. All home providers, the designated agencies and specialized services agencies are responsible for the contracting of those shared living providers. So they must, all of those individuals and anybody who the agencies hire must go through a background check. And those are provided by the provider agencies. Now, if a person, if a family member is the employer of record, so let's say you're a guardian and your adult child lives in your home with you, and you have funding for supervised living for somebody to come into your home to provide support or respite supports or community supports, and you are hiring those staff, you utilize our intermediary payroll organization called ARIS, Area Resources for Independent Solutions. I think that's what it stands for. And ARIS performs the background screenings for all of those individuals that you as a family member are hiring. Same thing if the shared living provider is the employer of record and hiring workers to be in the home. They utilize ARIS. ARIS performs all of those background checks. And those must be performed and completed satisfactorily before individuals begin working, before workers start working with people and services. Can parents be allotted monies to hire staff for specialized supports? For example, applied behavior analysis therapy for individuals with significant behavior issues. So, ABA supports are provided through state plan Medicaid for individuals up to the age of 21. So that is a separate support that does not go through HCBS. And it can be provided to folks up to the age of 21. Over the age of 21, if parents want to, again, if parents have funds allotted to them in the arena of community supports, employment supports, home supports, which would be supervised living, and they want to look for individuals who have specific skills to address behavioral issues, they are welcome to do that. But the funds are allotted as in that category, in whatever those categories of services are. So we don't have a category of service for applied behavioral therapies. We do have category of service. We have a clinical category of service for therapy, for psychiatric, for nursing. We also have a supportive services category, which addresses behavioral supports for individuals, behavioral consult. It also might include, there are some individuals who really benefit from therapeutic horseback riding. That can sometimes be funded. We also fund communication supports for individuals who have communication challenges under the supportive services category. What residential options are there for highly behavioral and intellectually challenged individuals that also require medical supports other than the placement in Rutland? That's an excellent question. The placement in Rutland is, again, the ICF-DD, and that really is for people with significant medical needs who require round-the-clock nursing. As far as the combination of medical and behavioral supports, again, it's very individualized. So there are a few group homes that have some specialization in both medical and behavioral together. There are also, we have been able to find some shared living situations where, with a lot of expertise and a lot of support and training, folks with medical and behavioral challenges have been successfully supported. There are also some staffed situations. Often it is those individuals who have the very significant behavior challenges and some level of medical need that require that 24-hour staffed level of support with oversight from the provider agency. Oh, that's a great question. Okay, so we have a question about a person whose son has developmental disability services who would like to live in an apartment with two friends, and he wants his staff support to live with them as well. That's a very interesting question, and I think that I don't know if you have had a conversation with your provider agency about what possible scenarios could be created for your son, but it sounds like there might be something that would work there. I don't know if your son really requires 24-hour supports or if intermittent supports would be successful, because he could live with his friends and receive those intermittent supports. And if his friends are in services, they could be getting their intermittent supports. Again, I guess the issue comes up if the individual if there's somebody who needs to live in the home, to be a 24-hour support to these guys, or to one of the guys, and how that would function. But it does sound like there might be some way to figure this out. But I would encourage you to sit down with your designated agency or specialized service agency to talk about options. And then, if needed, the division also can offer some consultation around setting up unique situations. Okay, a question about employment supports, vocational training options available for folks with challenging behaviors, require a high level support, may not be able to hold a job within the community. Are there sheltered workshops for this type of individual? There are not. Vermont we closed our last sheltered workshop in, I believe it was 2001, so really almost 20 years ago. We do have individuals who have unique work situations. We have folks that have created their own businesses. We have folks who work, who perhaps do work outdoors with their support person, might work for a landscaping company. Very challenging for them to work with other individuals, so they could develop a schedule that works for them, so they don't have to, interact with others. There are lots of, I think there are a number of possible configurations to support individuals who have behavioral challenges in employment opportunities. And I'm sure our employment specialist, Jenny Masterson, would be happy to talk to you more about some of those. Also, every designated agency has a supported employment coordinator or leader, manager of some type, and this would be a great conversation to have with the supported employment staff at your designated agency. Supervised living. You mentioned a person living in the individual's own or rented home. The provider would need to pay income tax on the stipend, but is this still a service provided or managed through an agency? Yes, it is. Okay, what happens if individuals with disabilities live with parents and parents die? What supports can they get? What happens about housing? So, yeah, this is a big one, and it's happening, and it happens. If in the best of circumstances, the individual who's been living with their parents has had some supports, has some connection to a provider agency, so that the agency is aware of the individual and can step in very quickly and provide emergency supports. There are other family members can become shared living providers. So parents cannot be paid to be shared living providers, but siblings, aunts, uncles, cousins can be paid to be shared living providers. Again, they have to pass a background check. The agency has to be, the provider agency has to be willing to contract with them. But they can, people can provide those types of supports to their family member and possibly get paid for it. We certainly have situations where the agency steps in very quickly to provide support, finds an emergency respite situation for a person whose parent has died, and that might or might not develop into a shared living situation. Often it requires that the agency really do an assessment of what's happening with the individual, what their needs are, and works to set up a situation for them. And of course, if in those situations, the division funds those circumstances back to the date of when the supports began. What type of ongoing oversight does the DA engage in with supported living providers and group home placements to assure safety of the individuals in care? That's a great question too. We have our guidance at the division is that shared living homes need to be visited on a monthly basis by the service coordinator at the agency. Certainly can be visited more often if needed, if there are issues or if there are medical concerns or behavioral concerns that crop up. The service coordinator should be available on an ongoing basis for questions or concerns for the home provider. There should be a management team at the designated agency who oversees all of the group homes. All group homes have a manager that is a direct line to the leadership at the provider agencies. That is, I think that's basically all I can say about that. Many of the group homes have some nursing oversight as well, so that there's an agency nurse going in and providing regular kind of medication administration and training and oversight of meds and medical needs to all the staff that are working there. Why can't parents, okay, I hope I answered that question sufficiently. Why can't parents be paid to be a shared living provider? What's the reasoning? Okay. Okay, yes, so yes, a sibling can be paid to be a shared living provider. As I mentioned before, there are other family members. So I know that this is a critical question for for a lot of families. We have looked at this issue a number of times over many years. Vermont has consistently made the decision within the Agency of Human Services that parents cannot be paid to provide services for an individual for their child, whether it's a minor child or an adult child in their care. It's conflict of interest reasons. It's concerns about the autonomy and the independence of the individual. Concerns about the responsibilities of guardianship when parents are guardians for a person, and the potential conflicts between guardianship responsibilities and shared living responsibilities. And we just have come to the conclusion multiple times over the years that it's not it is not a practice that we are going to endorse or include in our guidance and regulations. Okay, we're getting kind of towards the end of things. Okay for us to go past 10:30. Okay, there is another question. Daughter cannot administer her own medication and depends on us to provide. Due to sensory issues, she cannot swallow pills and has to have them crushed. What happens with this in shared living? Same thing. There should be a nurse who delegates the medication administration to the shared living providers, and can monitor the situation. But shared living providers are trained to appropriately administer medications to the person who lives with them. And what is the wait list time and number of individuals waiting for placements? Okay, so technically a little bit complicated in terms of the question about wait list time. So, and this really kind of goes to the questions about eligibility and access to services. And there are a number of hoops, of course, that folks must jump through. So they must be eligible for Medicaid in the state of Vermont. They must meet clinical criteria for as a person with a developmental disability within the state of Vermont, and this is all in our regulations, which I'm going to send the folks here at Vermont Family Network links to our website and our guidance documents, and they can send them out to everybody. And then if you have questions about those, we can, you'll have contacts to follow up with. So when people have jumped through, then the next hoop, so clinical criteria, Medicaid eligibility, and then if people meet a priority for funding, so if they meet a priority for home supports, if there is an urgent need for home supports, then there really is no wait list. You go through your designated agency, they develop a funding proposal that includes a request for those home supports. They bring that forth to us at the division, and if there's appropriate rationale for that individual to have home supports, if their health and safety is at risk because they have lost a family member, they have lost someone who assists them, they can no longer live in their family home or wherever they've been living for whatever reason. Their needs have increased dramatically, or their parent or supporters' needs have increased dramatically. And then those supports will be funded, and there is no wait list for the funding. Now, as far as the development of homes and the availability of homes at our provider agency, that is something that sometimes the designated agencies and specialized service agencies grapple with. They do sometimes have to put together, quickly put together emergency situations or respite situations for folks, which may or may not become a long-term solution, for individuals. Sometimes they do. It really depends on the circumstances. But if a person qualifies for home supports, under our system of care funding priorities, then they will be funded for it, and there is no wait list for the funding. Can I contact you if I have further questions? You absolutely may contact me. On this last slide here is my name, my desk phone number, and my email address. I will just share with you, again, I have a staff of a few specialists. I have a specialist for Northern Vermont, a specialist for Southern Vermont, who are specialists in policy around adult services. Melanie Feddersen works in Southern Vermont, and Nikki Marabella works in Northern Vermont. Diane Bugby is my children's services specialist, who works on policy around services for children, and collaborates a great deal across our agency of human services. Ed Riddle is my specialist in what is he the specialist in? I'm sorry, offender issues and folks who are on Act 248. It's a whole nother arena, but he is one of my staff as well. And so if you contact me, it's possible, based on your question, I might refer you out to one of my staff who can hopefully help answer your questions. But we're happy to try to engage with you and support you in your questions. I know it's can be extremely challenging for families when their young people are starting to age out of school, when they're looking at a whole different service system in adult services for folks.
So I want to thank Amy today and thank all of you for joining us for our webinar. We're going to save this webinar on our website and also on our YouTube channel, where we have more than 90 webinars saved. Our website is vermontfamilynetwork.org. You can find there a list of our upcoming webinars, a list of support groups, and we also have a fact sheet that might be of interest to folks. It's called Adult Services for people with developmental disabilities. We recently updated this, so you can find that on our website. Of course, we'd like to talk to anybody that might want to give us a call. We're parents ourselves here at Vermont Family Network. You can call us at 1-800-800-4005, and have a great day.